Hello and welcome to Pace Hospital's podcast. Today, we are diving into a vital yet often underestimated aspect of adult healthcare, that is, vaccinations. While childhood immunizations are widely discussed and followed, adult vaccinations are equally important in maintaining long-term health, preventing serious infections, and protecting vulnerable populations. To help us understand this better, we are joined by Dr. Mounika Jetti, Consultant General Physician and Diabetologist at Pace Hospitals, Hyderabad, with deep expertise in adult preventive care and immunization strategies. She helps us through everything that adults need to know about vaccines. Dr. Mounika Jetti, thank you for joining us today at Pace Hospitals, Hitech City. Let's start by understanding why do adults need vaccines and how are they effective?
Hi, I'm Dr. Mounika Jetti, Consultant Physician, Pace Hospitals, Hitech City. Today, we are here to discuss about adult vaccination, why is it important, and why vaccination is not just only for kids. Usually, after a certain point of age, the immunity which is provided by the childhood vaccines wean off. And also the immune system weakens. So, we need to retake the vaccines which we have taken already in the childhood so as to develop more immunity towards infectious diseases like influenza, pneumonia, etc. And also, it will reduce the incidence of infections, hospitalizations, and serious complications like deaths. So, coming to the effectivity of the vaccines, the effectiveness of the vaccine depends mainly on the kind of vaccine, whether it is live or attenuated, the disease what it is fighting against, and also the health and age status of the individual.
So, doctor, what are the vaccines that are recommended for adult population?
So, adult population usually requires vaccines like pneumonia, influenza, pneumococcal vaccines, meningococcal vaccines, MMR, hepatitis A, B, HPV virus vaccines. So in this tabular form, we have the vaccine, what is the recommended dose and schedule of the vaccine.
Dr. Mounika Jetti, what are the common vaccines that are given for pregnant women in India?
In India, the pregnant women are required or recommended to take certain vaccines like Tdap or TT, which gives protection against childhood and maternal and fetal tetanus. It is given in 2 doses. The first dose should be given in second trimester and the second dose should be given 4 weeks after the first dose. The other vaccine which is recommended for pregnant women are influenza vaccine, which is given as one single shot annually.
Can you explain which vaccine should be avoided during pregnancy?
So there can be a doubt expressed where what kind of vaccines are to be avoided during pregnancy. So during pregnancies, certain live attenuated vaccines like MMR, varicella and herpes vaccines, HPV vaccines should be avoided in pregnancy.
So doctor, how often should we get a tetanus shot?
Tetanus booster should be given once in every 10 years. Where you can take either Tdap, which will give protection against tetanus, diphtheria and pertussis, or just TD, tetanus and diphtheria, which is given once in every 10 years, or you can take a TT shot. But if you are involved in an accident or any wound which is dirtier and the wound is deep or the cut is deep and you have not taken your tetanus shot since last 5 years, you need a booster dose of tetanus vaccine in between these 10 years.
Dr. Mounika Jetti, one general question, what are the common side effects of vaccines?
Vaccines have certain side effects which are usually short-lived. The most common side effects include local reactions like redness around the injection spot or inflammation around the injection spot or tenderness around the injection spot. And the systematic complications include allergic reaction to the vaccines, fever which can be low-grade associated with headache or body pains. Some patients might complain abdominal discomfort, nausea or loose stools also. But there are serious and rare complications which include the anaphylactic reaction, which is so severe that there is blockage of respiratory tract, etc., and Guillain-Barré syndrome, or differences in platelet production like thrombocytosis or thrombocytopenia can also be seen, but these are all very rare.
Can we take 2 or more vaccines at the same time?
Another common question what everybody asks is, can we take 2 or more vaccines at the same time? The CDC, WHO, and other health organizations endorse co-administration of several other vaccines, barring any contraindications. For examples, like in case of live or live attenuated or live vaccines like MMR and varicella, at least a gap of 2 to 4 weeks should be given to avoid interactions. So there are certain techniques that needs to be followed when we are co-administering vaccines. Usually, if we are co-administering vaccines, they are given in separate limbs, or like you give one vaccine to one arm or the other limb, etc. like that. But if in situations where we have to give two vaccines to the same limb, at least a space of 1 inch should be maintained between each injection.
So, doctor, what vaccines are recommended for people with diabetes?
Diabetes and adult population are more prone for higher risk of repeated infections, and infections will go prolonged if the diabetes is not under control. So actually giving them the booster doses of all the recommended vaccines would actually help them not to fall sick very often, or not to get repeated hospitalizations, and they can avoid further complications because of getting repeated infections.
Dr. Mounika Jetti, one final question. Are there any vaccines that are given explicitly to cancer patients?
This is one of the most common doubt for cancer patients who are being treated or have already had cancer and now there's no relapse in disease. The most common doubt would be, can we take the vaccines according to the schedule, or do we need any specific cancer vaccinations? The regular vaccination schedule for adults can be followed in case of cancer patients also, but we have to check whether they are actively undergoing any chemotherapy or radiotherapy. In cases where they are actively undergoing chemo and radiotherapy, the vaccination should be given either 2 weeks or more than 2 weeks prior to the initiation of chemotherapy, or if the chemo or radiotherapy is done, they can be given after 4 weeks of the procedure like chemo or radiation. But in cases of specific conditions like stem cell transplantation, it would be recommended we wait for more than 6 months to get vaccinated. There are certain vaccines which are avoided during chemo and radiotherapy, as there will be immune suppression in most of the cases. So live vaccines like MMR and varicella are usually avoided.
We hope this episode has offered valuable insights into the importance of adult vaccinations. While often overlooked, staying up to date with your vaccines is a simple yet powerful way to protect yourself and those around you from preventable diseases. If you have any questions about which vaccines are right for you, don't hesitate to consult with a general physician or preventive health specialist. Your age, lifestyle, medical history, and travel plans can all influence your vaccination needs. Thank you for tuning into Pace Hospital's podcast. We'll be back soon with another informative episode on health and wellness. Until then, take care, stay protected, and remember, prevention is better than cure. Thank you.